Hello, I'm Debbie and I'm one of the SENDIASS advisors at Amaze, and today's question is, what does an education, health and care plan look like and what does each section mean? An education, health and care plan is made up of 11 sections entitled A to K, but some of those sections won't always be together, so you might not always find that they run in consecutive order, but they're mixed up, and that will depend on where you live and which local authority you live in. They may be linked to each other in different ways because they try to keep sections that are connected to each other together, and this will become clearer later. Section A is the most important section. It's the parent and young person's views, wishes and feelings. So it starts with the young person and you. And this is where you can detail all the things that you want for your child, all the things that they experience at home that maybe the school don't see, and all the things that you want for them in the future. Section B are their educational needs. So these are divided into 4 areas: cognition and learning, communication and interaction, social, emotional and mental health, and sensory and physical. Section B will outline their needs and is linked to Section F, which is their educational provision. So for every need that is identified in Section B, there must be educational provision to meet that need in Section F. Section C outlines their health needs. So if they have a health need, like epilepsy or diabetes, that will be outlined in Section C. Section G, which is linked to Section C, will outline the provision to meet those health needs. And for every health need identified in Section C, there should be provision to meet that in Section G. Section D are their social care needs. So this might have been identified by a social worker or something that you've identified as a need in your family. Section D, then, social care needs, are linked to Section H1 and H2, which is the social care provision. Some of the young people that have an education, health and care plan may be over the age of 18, and if they are over 18 then they are an adult. So the adult social care provision will be detailed in H2. Section E are the outcomes or goals that you want your child to achieve. The outcomes that you set should be SMART: specific, measurable, achievable, realistic and time-bound. Section I will name the school that you want your child to go to. The local authority and you may not be able to agree the name of a school, so they will name a type of school. This will be either a mainstream school or a special school. Section J will include details of a personal budget. Personal budgets can be asked by a parent who has a child with an education health care plan, and they must be used to help a child achieve one of their educational outcomes. So Section K is the last section, and that is the section where all the reports and appendices are listed. Check through Section K because it might be that you've given your caseworker some reports that haven't been included in your child's plan. So it's important to check that they have, and if they haven't, then contact your caseworker and ask for the reports to be included. I'm Debbie, and if you need any more advice or support from our SENDIASS team, please follow the card next.